Hey everybody, first YouTube video, and today I'm going to talk a little bit about cubital tunnel syndrome, ulnar transposition, or what we call anterior ulnar transposition, submuscular with Z-plasty. Cubital tunnel syndrome has affected me for the last 2 years, and I've had one surgery beforehand, which was an endoscopic small incision that ironically caused my nerve to sublux after the surgery, which happens in about 80% of individuals who end up having to have the surgery over again to have a transposition. So I'm going to give you a little tidbit about what cubital tunnel syndrome is, what forms of surgery you can have, and the route you should take conservatively as well as surgical. I had my surgery at Johns Hopkins facility in Baltimore, Maryland, which is a very prominent hospital in the U.S. And as of today, I am currently, as you can see, 2 days post-op from ulnar transposition submuscular with Z-plasty. Not horribly too bad as far as the pain is concerned. It was pretty bad the first day. A lot of muscle twitching, involuntary type stuff, which is typically usually typical after something like this. My issues started about 2 years ago and really came about from a lot of computer use. Lifting in the gym, I used to get pain in the forearm, odd sensations in the fingers you couldn't really understand. It's kind of like noticing your fingers when really you shouldn't be noticing your fingers at the end of the day. Most people, or a majority of people, also have this bilaterally, which I do as well, which will involve a surgery on the right. But I tried all conservative measures, which didn't seem to work. Everything from splinting at night to sleeping like Jesus on a cross, because that's about as comfortable as you can get with this. It is the gift that keeps on giving and does not stop, and it is relentless. So I started to notice it, and typically a lot of people might freak out, which I did as well, and didn't have any explanation as to what was going on. And your first route is always conservative measures. You should always see a doctor for such things like this. Don't spend your time on Google, Facebook, forums, trying to figure out and diagnose yourself. Go see a doctor. Don't waste your time. You're going to get bent out of shape, anxiety ridden. Just go see a surgeon. Go see a neurologist. Get a nerve test and go from there. I tried conservative measures, which didn't work. And shortly after that, started getting what we call NCV tests, nerve conduction velocity tests, as well as an EMG, which is a needle test that they put into your muscles in order to measure the electrical impulses in your muscle fibers. And mine slowly got worse over time. Anything that is a 12 millisecond change between your above elbow and below elbow is typically indicative of cubital tunnel, and most times surgeons will operate due to those findings, also as well as your amplitude and latency in your nerves. I have a lot of people I've seen or watched videos on here who really don't know much about cubital tunnel or have an idea of understanding of how it's caused or what there is to do about it. It's a compression issue, whether it's from muscle fascia, compressing your nerve above or below, or it's just from repetitive use of flexion in your elbow. That's why it's such a difficult thing to cure, or rather stop symptoms. You can't get by without bending your hand on a daily basis. So I had the nerve tests, and they slowly got worse and worse and worse and over time, and became problematic. It's pretty painful, especially having it bilaterally. My recommendation to people out there is see a surgeon, have the tests, try conservative measures, and if they don't, go the route of surgery. But before even having surgery, in my experience, you need to see the best microvascular hand surgeon slash plastic surgeon you can find. Don't just go to your ordinary run-of-the-mill orthopedic surgeon who works on shoulders, knees, and elbows. These are people who deal with more structural, mechanical slash bone cartilage issues. Microvascular hand surgeons deal explicitly with muscles, soft tissue fibers, veins, nerves. These are the people you're going to find get better results out of having these surgeries. And unfortunately, I didn't have a good result the first time with the subluxing of my nerve over the medial epicondyle, which felt like a snapping issue, or felt like your nerve got really tight. Constant elbow pain. So conservative measures, nerve tests, and then surgery, and then find the best surgeon you can find. I'd also, if you have an issue finding a a surgeon in order to have the surgery with, usually try physical therapy or occupational therapy first. Once you do that, I would ask the therapist who they recommend, because usually they're going to give you a better idea of what surgeons have better outcomes compared to other surgeons. It's kind of your best bet. Don't read forums. Those typically aren't really the best way to go about finding a doctor. However, you do find some informative information and ideas of what to look forward to. The recovery is a lot longer for anterior transposition of the ulnar nerve, submuscular, which means they do in what they call a Z-plasty, which creates a zigzag like a Z within the pronator muscle here, and where they embed the nerve within the muscle. Subcutaneous is a little different. They create a fascial flap basically that goes over the nerve, but a lot of people end up having problems because the nerve starts to slide out of position years down the road or in due time. Submuscular is the gold standard. Cubital tunnel surgery that's endoscopic is just a release of the tunnel. A lot of people have problems with that, which I obviously did. So I went the route of a transposition. My doctor was Dr. Dune at Johns Hopkins. He's an international and well-known national surgeon in Johns Hopkins in Baltimore, Maryland. And hopefully this route will cure, or if not, stop the issues that I'm having. I didn't really have a whole lot of pins and needles, which some people do when they get muscle atrophy. Mine didn't get that far, but the relentless, constant elbow pain it can be staggering. So in my experience, the surgery itself is pretty quick. Different methods about being knocked out, whether it's general, local, or just twilight sedation. It's not bad. The pain is tolerable for anybody out there who's concerned about post-op pain. I'm day 2. I think I've had maybe 2 or 3 pain pills. It's not extremely bad. It is a very large incision for people who are a little scared about it. It's about 2 to 3 inches up your ulnar and above your elbow. So there should be an incision that probably goes from about here to here. It's unsightly, but for the surgery itself, to relieve yourself of the pain versus continuously sticking with it, you better just have the surgery. As a whole, it's been a pretty horrible experience, but I'm looking forward to living without the pain. Cubital tunnel syndrome has no boundaries. It doesn't pick and choose. It just happens, whether it's partially genetic or from repetitive stress. It just kind of happens. So this is just my 2-day post-op to give you an idea of what to look forward to, what route you should take when you start having symptoms. Usually you'll have the symptoms in your pinky, this finger, and then on half of your middle finger. But people can feel it kind of in all the fingers. It supplies a bunch of medial, or what you would call other nerves within your forearm that control and give sensation up and down your forearm. So it can be kind of hard to tell if it's coming from your medium nerve in your wrist versus your actual ulnar nerve in your elbow. And we all know what that feels like when you bang your elbow. It's a burning sensation. And that's not something I really ever had, but you can have it after a long day of using your arms quite extensively. So that's my post-op for 2 days for a cubital tunnel ulnar transposition with Z-plasty, and I will hopefully give an update every week or so. If you have questions, concerns, anything you want to ask in terms of the surgery itself, I found a lot of videos on here are really indicative to knowing what's going on with the surgery. You should be well informed when you have this surgery because it is not an easy surgery. It's not something you should take lightly and just jump into because you can have issues after having the surgery. You can lose motor function, sensory function. You can have numbness. So these are all things that surgery can cause. Typically don't, but that's based off of the surgeon you choose in having this surgery. So make wise decisions in terms of picking a surgeon who is knowledgeable and who has done a lot of these and who deals with microvascular soft tissue issues. And if you have any questions, let me know.